and found that the provision in the old law that limited medical assistance in dying only to individuals whose illnesses were terminal, that she found that was unconstitutional. That part of the law was struck down, and it gave the government a deadline to come up with the new law that would also allow individuals whose deaths are not reasonably foreseeable, so therefore who have illnesses or disabilities but who aren't terminal, to also be eligible for MAID, which is what this new law does.
I know there's a lot to this, and I want to unpack it. And so I want you to tell us about Bill C7, which is now law. I want to talk about what's new in this bill, and I think you just sort of already mentioned it there. The big thing here is that MAID is going to be more accessible to more people now, right?
Exactly. The biggest thing about C7, which is what's new, is that it now opens up MAID to individuals who don't have deaths that are reasonably foreseeable, who don't have terminal illnesses, who have disabilities, but who are not in a terminal state. So it expands to that. That's a huge group of individuals that MAID is now expanded to, and it comes with a whole set of new safeguards for that group. And of course, for those whose deaths are reasonably foreseeable, who have terminal illnesses, MAID is of course still available to them, but it does expand to a wider group now for sure.
The interesting term here is reasonably foreseeable. You've already mentioned it twice. To be clear, that's people with terminal illnesses, incurable diseases, who we know are going to die because of it. Deaths that are not reasonably foreseeable. What exactly does that mean, and who fits into that category?
So those are individuals who still have to meet the other criteria in the law, which was not struck down by the court. So the other criteria for MAID is that you have an incurable illness or disability, you are considered to be in an advanced state of decline, and you find that you're suffering intolerably as a result of it. So those are the main criteria to still be eligible for MAID. So you still need to be assessed by two different medical professionals to determine if you do meet that criteria in order to be eligible for MAID. And in the case now of those whose deaths are not reasonably foreseeable, but who do meet that other criteria, according to the new law, there has to be 90 days between the person's first assessment for MAID and the procedure being carried out. Some might say it's a large chunk of time. Some others might say it's not enough, but it gives a certain amount of time for medical professionals to truly determine that this individual who doesn't have a terminal illness is still eligible for MAID.
That 90-day waiting period, that's sort of new. What are the other new checks and balances that are spelled out in this law? What other significant changes? What do people have to sort of deal with if they're considering this now?
So the 90-day period, yeah, that's absolutely new. And that's only for individuals whose deaths are not reasonably foreseeable. And it's to allow for enough time for those two independent medical assessments to be done to ensure that the person meets the criteria. Other things that are new for that group of individuals is that it explicitly says in the law that those individuals need to be informed of other options that could potentially relieve their suffering. So counseling, mental health supports, palliative care, and also that the medical professionals need to ensure that consultations are made with the professionals who can offer those services. So that all needs to be in place before the person can actually go ahead and receive MAID. So that's another safeguard that's in place. They need to sign their request for MAID in front of an independent witness, and then they need to be told that they can withdraw the request at any time in the process.
Now, the judge gave a deadline for this to be passed. It got extended how many times?
In the end, it was extended 4 times by the Quebec court for a variety of reasons. The ruling came down in September 2019, and it was a huge ruling, and the government was given a year to come up with a new law. But in the meantime, we had the COVID-19 pandemic hit, prorogation of Parliament. It was very slow to get out of the House of Commons and into the Senate. It was a bit slow in the Senate, and then the Senate added amendments to the bill, and it had to be sent back to the House of Commons to be debated again. So a lot of procedural delays. So in the end, it was extended 4 times. And the deadline, the 4th deadline to have this thing passed was March 26th. And the judge had said, this is the ultimate deadline extension. Like, you will not get another deadline extension. So you have got to get this bill passed. It has been too long. And they got it in just about a week before their final deadline. So they just did it.
Well, we're journalists, so we appreciate that. But it does feel like they kind of just got it under the wire. I mean, MAID is one of those huge things that once you start thinking about it, it just has so many thorny implications. And now Let's talk about the criticisms of this bill. I think that a lot of them are coming from disability advocates. What are they saying? What are they concerned about?
What this bill does is that it now would allow individuals with a disability, but who are not near death, who don't have a terminal illness, but it would allow individuals with disabilities to potentially apply and be approved for MAID should they meet that criteria and be assessed and go through the process and it's approved. But it opens up the door to that group of individuals to apply for MAID. And what a lot of advocates for persons with disabilities have said is that this bill sends the message that people with disabilities, that their lives are less valued. And also that some of them live in some dire conditions in Canada. Some of them live in poverty. There's a chronic lack of supports and services for individuals with disabilities in terms of housing, in terms of counseling, in terms of other supports. And so the argument is that due to that chronic lack of services and supports, it could push more people with disabilities to want to apply for MAID because they don't have access to supports and services that they need. So the argument is, why doesn't the government just focus more on improving those supports and services rather than giving people with disabilities this option, this MAID option? So that's the biggest criticism of this bill. There's a huge concern that it will push a lot of people with disabilities to apply for MAID, when if they had the support services in place, they might not have done so.
We'll be right back. I think the other really tricky thing, and this has not been decided yet, but down the line, potentially people with mental disorders might also be allowed to end their lives under this new rules. No, but that's something that still has to be worked out, right? Where exactly is that, and what happens next with that?
Yeah, that's another really tricky, polarizing issue, is that the bill states that there's a 2-year sunset clause in the bill for individuals with mental disorders. So it gives governments and medical bodies 2 years to come up with guidelines and safeguards for individuals to access MAID solely on the basis of a mental disorder. And this has polarized even psychiatrists. There are psychiatrists who say that this would apply to a very small group of individuals who have had a severe mental disorder for a number of years and have tried a number of evidence-based treatments, none of which have worked. And it would be a very small number of individuals who could actually access and be approved for MAID in that category. Other psychiatrists have argued that it's impossible with any mental disorder to determine prognosis, whether the person's mental disorder could be improved down the line. It's very difficult to determine that, and that it would be unsafe to open MAID up to that group of individuals. But what's interesting to note is that individuals with mental disorders have always been eligible for MAID since the beginning if they have a physical illness that meets the MAID criteria. So we're talking about individuals accessing MAID solely on the basis of their mental disorder. And so that's what the government has 2 years to focus on and come up with guidelines and safeguards for.
So another deadline that they're probably going to miss. Anyway, we'll see.
Yeah, 2 years down the road, who knows?
That sounds like an impossible problem for me to even wrap my head around. And potentially, how do you figure out if someone is mentally fit to be able to make that decision if they are dealing with that disorder, right? Like, I mean, this just sounds like one of those incredible catch-22.
Exactly, because I mean, one symptom of several severe mental disorders is suicidal ideation. So how do you know that the individual who's requesting MAID is not requesting it based on the symptom of their illness versus is actually totally capable of making this decision? That's the big part of the assessment process that psychiatrists are going to have to focus on once this is made possible in 2 years. So that's what I think a lot of experts are going to be working on over these next 2 years, is how do you come up with guidelines to ensure that the people requesting MAID on this basis have the capacity to make this decision.
The first one of these is one of the things that hasn't changed. And I had never even thought about this. And this is the idea, well, now you can't make an advance request. You can't basically just decide, all right, you know what, 85, good run, whatever I'm in. You can't do that. But then the other one that I think is a little bit more thorny and still not eligible is children, right? So those are two categories that have not changed. Can you take us a little bit through the reasoning behind both of those?
So for children, or as they're called in the world of MAID discussions, they're referred to as mature minors. So that issue, the government has said that absolutely warrants further study. We can't touch that issue right now. They're on the cusp of setting up a joint House of Commons Senate committee in the next few weeks to study a range of MAID issues and the state of palliative care in Canada. And that will be one of the issues that they study, is how do we open it up? Like, does MAID get opened up to children? If so, how does that work? Even in countries in Europe that do allow it, there are very few countries in Europe that do allow it. The number of children who are being approved for MAID are quite low. I think it's in the single digits over the last few years, like very, very low. It's a very extremely small number of individuals. There was a study in Canada done a few years ago on mature minors in 2018, and I think they determined that no child had ever actually tried to make a request for MAID. So it's a very rare occurrence to begin with, or it certainly looks that way. And then with advanced requests, that would be for individuals who don't meet the criteria now for MAID, but would like to make the requests now. Like, this is one example, in case years down the road, they lose the capacity to make that decision. So that's like individuals with dementia, some of whom have really strongly advocated for this, that they've been diagnosed with dementia, but they don't meet the criteria now for MAID. They're not suffering intolerably. They're not in an advanced state of decline. So they don't meet the criteria now, but they want to be able to make the request now to be carried out at a later date should they lose capacity. Based on some of those arguments, the Senate had actually tried to include that in the bill, the possibility of advance requests, but the government rejected it. They rejected the amendment because they said that it goes beyond the scope of this bill and it requires further study. So that will also be studied by that joint committee I mentioned that's going to be looking at mature minors as well. So that's also being pushed down the road to a later date.
You mentioned some countries in Europe and their MAID laws. How do we compare? I would expect Europe to be just a bit more open with some of these things.
We often talk about like the Benelux countries, so like Belgium, Netherlands, Luxembourg. They have fairly expansive MAID regimes. And so Canada certainly does come close to their system, because in some of those countries, you can access MAID solely on the basis of a mental disorder. And there have been cases of mature minors accessing MAID. So Canada is not quite where they are yet. I mean, some advocates have also argued that Canada's MAID regime is now the most expansive in the world, or among the most expansive in the world. But certainly there are still some categories of individuals in Canada at this moment who can't access MAID, but who technically could in some of those European countries, especially those act solely on the basis of a mental disorder.
One of the things you mentioned in this story is that there were 5,631 medically assisted deaths in 2019, which was a 26% increase over 2018. Obviously, this law is going to make this a bit more accessible for people, with more people potentially eligible. It's fair to say that number's probably going to grow, right? What do experts think about that?
The number will almost certainly grow, but it's just that no one can really predict. I remember asking experts about this, like, will the numbers go up? And the consensus is like almost certainly yes, but it's difficult to predict by how much. It's also been difficult to determine. I think it probably requires further study, but why the numbers were already going up between like 2018 and 2019. One argument that's been made is more people are just being made aware now of MAID and how to access it, and it's becoming part of more discussions among individuals who are at the end of their lives. So it's really difficult to determine why the numbers were going up in the first place, but they will almost certainly go up further now that it's open to more individuals to apply. So those annual reports usually come out in the summer. So we won't really know the impact of this bill until probably summer of next year to see just how many individuals applied in 2021. And one thing, though, that the bill does do now is that it mandates the collection of data pertaining to race and disability in terms of people who are accessing MAID. So we might actually get some better data in the near future on individuals who are accessing MAID, helping to paint a better picture of just who is applying and getting approved for MAID.
So what's next? What are you following with this story? Is it basically that Senate committee that starts to try to figure out the even thornier issues of this?
Yeah, that's pretty much the next step, is that committee had to be struck within 30 days of the bill being passed into law. So that's a joint House Senate committee. So it'll be interesting to see who's on that committee and what are the exact parameters of their study. There have been some big ideas floated about what will be studied, including like the possibility of advance requests and children being able to access MAID. But it'll be interesting to see what are the specific parameters of that. And then they're supposed to report back within 1 year on their study. So it'll be interesting to see who they speak to, who are the experts that they'll be consulting. And also the kind of discussion and study on how to open this up to individuals with mental disorders will also kind of kick off in the near future, because they've got 2 years to do that. So it's really a lot of study now. But also, finally, I think it'll just be interesting to see if there are any further court challenges to this new bill. from people who might argue that it still doesn't go far enough, or perhaps from people who think it goes way too far. And then it'll play out again in the courts to see if it gets struck down again. Always a possibility. Yeah, so that'll be something to watch for too, is court challenges.
Fascinating stuff. Jacques, this has been great for us. Thanks so much for bringing us up to speed on it. Is there anything that I didn't ask that you think that our listeners should know?
I would just point out what I've heard from when speaking with MAID assessors and providers, which is that when it comes to applying for MAID, the assessments are rigorous and they can take a while. And so what MAID providers and assessors have often said is that it's not a question of you coming into the office one day saying, I don't feel so great anymore. I'd like to access MAID. Can I get it? Stamp of approval, you get it. These assessors that I've spoken with have said they take a long time, sometimes months with patients to assess their capacity to make this decision, their level of vulnerability, whether they meet the criteria, whether they've been coerced at all into applying for MAID. It's just something I would point out is that MAID assessors and providers have often emphasized that these assessments to end your life can take a very long time and are thorough and rigorous.
Well, I would hope so.
Yes, I would hope so too.
Jacques, thank you so much for your time today.
Thank you.
Jacques Gallant is a reporter covering federal politics for The Star. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajan Budler, Adrian Chung, and Saba Etizaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.